Hello friends, welcome back. Today we'll study about acromegaly. acro का मतलब होता है extremity and megaly का मतलब enlargement. So इस disease में extremities enlarge हो जाती है. ये होता क्यों है? Because of excess of growth hormone और ये सिर्फ adults में पाया जाता है क्योंकि अगर ये childrens में होता है तो ये gigantism के रूप में आता है. gigantism में क्या होता है कि body की हाइट जो होती है वो बहुत ज़्यादा इंक्रीज हो जाती है, जबकि एक्रोमेगली में हाइट नहीं इंक्रीज होती है पर सिर्फ जो एक्सट्रीमिटीज होते हैं वो एनलार्ज हो जाते हैं या फिर ऑर्गन का एनलार्जमेंट हो जाता है. सो एक्सेस ऑफ ग्रोथ हार्मोन आफ्टर प्यूबर्टी में एक्रोमेगली दिखाई दिया जाता है और एक्सेस ऑफ ग्रोथ हार्मोन बिफोर प्यूबर्टी के केसेस में जिजांटिज्म होता है. एंड एक्रोमेगली जो होता है वो यूजुअली पिट्यूटरी ग्लैंड में से अगर ग्रोथ हार्मोन बहुत ज़्यादा अमाउंट में प्रोड्यूस होता है तो उसकी वजह से होता है. एंड इसके जो इनिशियल सिम्टम्स होते हैं वो यही होते हैं एज एनलार्जमेंट ऑफ द हैंड्स एंड फीट. Causes of acromegaly, about 98% केसेस में acromegaly pituitary adenoma की वजह से होता है. Pituitary adenoma is the benign tumor of the pituitary gland which leads to overproduction of growth hormone. और बहुत ही कम अमाउंट ऑफ जो रिमेनिंग 2 to 5% पीपल होता है उनमें पाया जाता है कि अगर पिट्यूटरी ट्यूमर की वजह से नहीं होता तो दूसरे जो ट्यूमर्स होते हैं, फॉर एग्जांपल द ट्यूमर ऑफ लंग या पैनक्रियास और एड्रिनल ग्लैंड, दे स्टार्ट टू सिक्रीट द एक्टोपिक ग्रोथ हार्मोन लीडिंग टू एक्रोमेगली. एक्रोमेगली के सिम्टम्स जानने से पहले लेट अस ऑल स्टडी द की पॉइंट्स रिलेटेड टू ग्रोथ हार्मोन रिलीज एंड रेगुलेशन. हाइपोथैलेमस दो तरह के पेप्टाइड्स को रिलीज करता है, द फर्स्ट बीइंग द ग्रोथ हार्मोन रिलीजिंग हार्मोन एंड द सेकेंड बीइंग द सोमैटोस्टैटिन. ये दोनों ही ग्रोथ हार्मोन के रिलीज को रेगुलेट करते हैं. जो ग्रोथ हार्मोन रिलीजिंग हार्मोन होता है वो ग्रोथ हार्मोन के रिलीज को इन्हांस करता है बाय स्टिमुलेटिंग द एंटीरियर पिट्यूटरी, जबकि जो सोमैटोस्टैटिन होता है वो ग्रोथ हार्मोन के रिलीज को डिक्रीज करता है बाय इनहिबिटिंग द एंटीरियर पिट्यूटरी. ऐसे कौन कौन से केसेस होते हैं जिसमें ग्रोथ हार्मोन रिलीजिंग हार्मोन का रिलीज होता है? इन द केस ऑफ द स्लीप, हाइपोग्लाइसीमिया, स्ट्रेस एंड वन मोर वेरी मच इम्पॉर्टेंट इज एक्सरसाइज. Whereas in the cases of aging, obesity और ग्लूकोज, जो ग्रोथ हार्मोन रिलीजिंग हार्मोन होता है वो रिलीज नहीं होता है. वंस ग्रोथ हार्मोन एंटीरियर पिट्यूटरी से रिलीज हो जाता है वो लीवर में जाकर इंसुलिन लाइक ग्रोथ फैक्टर और IGF के सिक्रीशन को लीड करता है, जो फर्दर बोन डेवलपमेंट और मसल डेवलपमेंट के लिए रिस्पॉन्सिबल होता है. In the bones, they increase the amino acid uptake, they increase the protein synthesis, DNA and RNA synthesis, the collagen synthesis, the chondroitin sulfate synthesis, and also the cell size and the number. Muscles में they increase the amino acid uptake and also the protein synthesis. Here I forget to mention one thing that the IGF को सोमैटोमेडिन से भी कहा जाता है. ग्रोथ हार्मोन का एक और इफेक्ट होता है कि वो ग्लूकोज अपटेक को डिक्रीज करता है और इसलिए ग्रोथ हार्मोन को डायबिटोजेनिक भी कहा जाता है एंड ये लाइपोलाइसिस को भी लीड करता है. नाउ तो ये जो IGF रिलीज होता है जिसे सोमैटोमेडिन भी कहते हैं, वो फर्दर रिलीज होने के बाद ग्रोथ हार्मोन के सिक्रीशन को इनहिबिट करता है एंड ऑल्सो इनहिबिट द सिक्रीशन ऑफ द ग्रोथ हार्मोन रिलीजिंग हार्मोन. वेरेस जो ग्रोथ हार्मोन होता है एक बार जब वो एंटीरियर पिट्यूटरी से रिलीज हो जाता है तो वो खुद भी एक सिग्नल भेजता है जिससे वो ग्रोथ हार्मोन रिलीजिंग हार्मोन को इनहिबिट करता है हाइपोथैलेमस से रिलीज होने के लिए. इसी की वजह से जो ग्रोथ हार्मोन होता है उसका रिलीज पल्सटाइल होता है. इट मीन्स कि कभी वो ब्लड सीरम में हाई होता है, कभी बहुत लो होता है, तो इसलिए जब हम डायग्नोस भी करते हैं तो हम यूजुअली ग्रोथ हार्मोन के लेवल्स से एक्रोमेगली को डायग्नोस नहीं करते हैं बिकॉज उसका जो लेवल होता है वो परमानेंट नहीं होता है. Now let's just read the text related to the growth hormone regulation. The first point says the hypothalamus release the peptides growth hormone releasing hormone and growth hormone inhibiting hormone जिसको somatostatin भी कहते हैं into the hypophyseal portal venous blood surrounding the pituitary. ये hypophyseal portal system क्या होता है? This is just the blood vessels जो कि hypothalamus और anterior pituitary को connect करता है. In the next slide we'll see the picture related to this. The second point says कि जो growth hormone release होता है in the pituitary is primarily determined by the balance of these two peptides, which in turn is affected by many physiological factors that can be whether stimulators, for example exercise, nutrition, sleep, or they can be inhibitors like free fatty acids for growth hormone secretion. The third point says that the growth hormone stimulates linear growth and muscle mass through IGF, that is insulin-like growth factor, which is also known as somatomedin C, which is secreted by the liver. Growth hormone can cause insulin resistance and therefore it is also known as diabetogenic by decreasing the glucose uptake. एंड जो ग्रोथ हार्मोन की सिक्रीशन होती है वो इंक्रीज होती है कब? ड्यूरिंग एक्सरसाइज, डीप स्लीप, प्यूबर्टी एंड हाइपोग्लाइसीमिया, जबकि जो उसकी सिक्रीशन जो होती है वो डिक्रीज होती है बाय ग्लूकोज, सोमैटोस्टैटिन एंड सोमैटोमेडिन. दिस इज द पिक्चर ऑफ हाइपोफेशियल पोर्टल वेनस सिस्टम जहाँ पे वी कैन सी दैट हाउ द ब्लड वेसल्स connect the hypothalamus to the anterior pituitary. Now let us see the symptoms of acromegaly. The first and the foremost symptom is the large tongue with deep furrows. So it is large tongue with deep furrows. We can see in the picture कि tongue कितना ज़्यादा large हो गया and furrows also we can see in this picture and also here. The next symptom is large hands and feet. So here we can see that the acromegaly person is having comparatively large extremity than the person with normal growth hormone level. The next symptom which we can see is splaying of the teeth. This is because as the jaw grows, the teeth moves apart. And mostly we see that the upper teeth are normal, but the lower teeth or the teeth in the mandible are mostly affected. The next symptom is coarsening of facial features with aging. So in this picture we can see a normal person without acromegaly, whereas in this picture we see that the patient suffers from acromegaly. Here we can see the wrinkles which are the most common symptom of aging. Also we can see broad nose with broad lips. This all indicates that the patient is suffering from acromegaly. The next symptom is frontal boozing. In this the forehead protrudes. अब ये होता क्यों है? Because of the enlargement of the bones of the skull. The other symptoms of acromegaly includes deep voice. This is mainly due to enlargement of tongue and development of muscles of larynx. Second is diaphoresis, which means excessive sweating. The third one is the impaired glucose tolerance, which leads to insulin resistance. The fourth one is the hypertension. The fifth is the carpal tunnel syndrome because of the increased pressure on nerves. Sixth is congestive heart failure, which is the main cause of death in the cases of acromegaly, and this happens because of enlargement of heart. And the last one, but not the least, is the increased risk of colorectal polyps and cancer. This is because of the hyperplasia which take place in the colon and the rectum. Now how do we diagnose acromegaly? So first we can see for the increased serum IGF-1, that is increased serum insulin like growth factor 1, and second is failure to suppress serum growth hormone following oral glucose tolerance test. That is, even after giving glucose solution, if the growth hormone doesn't suppress, it means that the there is the condition of the acromegaly. And also MRI. In the MRI, as we can see, pituitary mass, so it helps in diagnosis of cases of acromegaly. How to treat acromegaly? Acromegaly का treatment depend करता है उसके underlying cause में. For example, if acromegaly is due to pituitary adenoma, तो it's important for us to resect the tumor either surgically or through radiation therapy. अगर उसके बाद भी उससे क्योर नहीं होता है तो we get into the pharmacological aspect of treatment where we use treatments like somatostatin analog जो कि ग्रोथ हार्मोन के सिक्रीशन को इनहिबिट करते हैं and one of the drug which belongs to the group of somatostatin analog is octreotide. Next, we can also give growth hormone receptor antagonist, for example pegolisomant. Or we can also give dopamine agonists which also inhibit the release of the growth hormone, and one example given here is carbergolin. Now let us solve some questions. In this, a 46-year-old woman comes to primary care physician because of persistent headaches and swellings of her hands and feet. She states the headaches have been occurring daily for the past 6 months and that the swelling in her feet has caused her to buy increasingly bigger shoes. She has had limited access to medical care, doesn't take any medications, and has no history of major medical illness. Temperature is 36.7 degrees Celsius, pulse is 75 per minute, and blood pressure is 140 per 90 mmHg. On examination, she is found to have a prominent forehead, bilateral enlarged feet and hands, and numerous skin tags. She is found to have a high level of two hormones related to her symptoms. One hormone increases the release of the second hormone. Which of the following cellular signaling mechanisms is most likely associated with the action of the second hormone? Pause the video and take some time and answer. So in this case, we see that the patient has swelling in her feet, hands and feet, due to which she has to buy the bigger shoes. So this indicates that there is enlargement of the hands and feet. Plus there is prominent forehead and also numerous skin tags. Here itself it is mentioned that there is bilateral enlarged feet and hands. This all suggests us that the patient is suffering from acromegaly. Now she is found to have high level of two hormones. So one to we know because of acromegaly there will be increased level of growth hormone. The other one will be IGF, insulin like growth factor, which is released due to release of the growth hormone. So elevated growth hormone leads to increased insulin like growth hormone insulin like growth factor 1 which is made in the liver. Now how does this insulin like growth factor works? It actually binds to its receptors, and the cellular signaling molecule which is associated with it is increasing the phosphorylation of tyrosine residues, because as it binds to its receptor it causes the increased activation of the tyrosine kinase. Now let us see this question in which a 62-year-old male with a history of chronic alcohol use disorder comes to the emergency department with worsening abdominal pain for the past 2 months. He has had loose stools that are difficult to flush over the past several years. A CT of the abdomen is shown. He is prescribed a drug that reduces the secretion of a pituitary hormone. The prescribed drug is most likely an analog of which of the following hormones? Pause the video and take your time to answer. This is the case of chronic pancreatitis, which may be seen in patients with chronic alcohol use disorder, and this can cause pancreatic dysfunction, which can present with abdominal pain and steatorrhea due to decreased ability to digest fat. So the drug which is used in this case is usually somatostatin analog, which is octreotide, because they decrease the pancreatic fluid secretion, thereby decreasing pancreatic activity, and they help in the management of pain in patients with chronic pancreatitis. As we all know that somatostatin or octreotide also inhibits growth hormone secretion, so the answer to this question will be somatostatin. In the CT also we can see that the pancreas appears to be there appears to be calcifications on pancreas. Hey friends, I won't explain the last two questions because I want you all to read and answer them by yourself, and then I request you to send me the answer to each question in the comment section below. Also, I will like you all to mention the reason behind your answer. Thanks for watching. Please do comment your answers in comment section. And of course, if you enjoyed this video, please feel free to like, share and subscribe. Thank you.